Hi everyone. So I'm Rebecca. I'm a customer success manager with patientMpower. So as described earlier, patientMpower provides a platform for remotely monitoring respiratory patients. And we work with respiratory specialist centres in the US, the UK, and in the EU. And today I'll discuss how ILD centres are using data collected via the patientMpower platform to provide optimised care for their patients, both as part of patient consultations and also to manage patients between scheduled appointments. So for those of you that are not familiar with the patientMpower technology, it comprises of a patient-facing app that's connected with a suite of clinical-grade medical devices, including home spirometry and pulse oximetry. And all data recorded by the patient in the app is available to the clinicians in an internet-based secure portal. So one of the ways in which centres are using the patientMpower technology is to provide clinical parameters for their patients during their virtual consultations. So by having real-time data transfers, patients are able to take a spirometry assessment during the virtual consultation, and that information is immediately available for the clinician to review on their portal. So even prior to COVID, one of our centres have found that they've reduced the need for face-to-face appointments by as much as 70%. And centres have talked about how this has, been indispensable during the COVID period, and now in this post-COVID time, how it's increasing their clinical capacity. So as well as virtual consultations, the technology is also allowed for management of patients between their scheduled appointments. So with periodic reviews of ILD patient data, they're able to identify trends and issues and intervene with these patients. So centres have spoken about how they've used the data collected through the patientMpower platform to manage their stable patients virtually, and how they've been able to focus on patients that are deteriorating or those that have greater care needs. And they've also spoken about how patients are reassured by having this clinical oversight while not being able to visit their clinics and visit the centres. And looking at some clinical use examples, so we've received reports where ILD patients' disease is progressing, and this has been identified quickly at home before a patient would have been seen in a centre. And one of the centres have reported how they've been able to refer one of their patients for lung transplant assessments much more quickly than they would have otherwise. And this has been valuable in the context of where there's been reduced access to spirometry in clinic. But the clinical use also does extend outside of home spirometry with a suite of medical devices connected with the app. ILD centres are able to get a holistic review of their patients, looking at multiple patients' clinical parameters. So monitoring of oxygen saturation has allowed the identification of patients that are desaturating and has enabled them to be assessed for supplemental oxygen much more quickly, managing their symptoms and keeping the patient then active in their daily life. And of course, with the unexpected nature of exacerbations, early identification of exacerbations leading to early intervention, is allowing centres to optimise their patients' care. And we have received reports from centres where they've been able to identify patients that are exacerbating, intervene with treatment, and are having successful patient outcomes. So thank you. And if you have any questions, you can email us at info@patientmpower.com or visit our website below.